The overall goal of this educational opportunity is to really enable the students to really collaboratively plan together an intervention for children to reduce the incidence of early childhood caries. I don't expect nurses to be dentists, and I don't expect our dentists to be nurses, but they need to know what each profession is about, how they can work together. And the biggest thing for our pediatric nurse practitioners is to look at a child when they're doing that early visit and being able to see if the child indeed needs to, see a dentist right away, see a dentist routinely, but to make that referral, to give that oral health education to the parent. Because even though in dentistry, in pediatric dentistry, we say that children should have a dental visit and establish a dental home by 1 year of age, we still are having a hard time. They're not breaking down our doors at 1 year old coming in here. But when you think about the pediatric nurse practitioner who's a primary health care provider, they're seeing the children at a much younger age. And if we can, again, working together, get them to identify some, early needs and get them to a dentist, get that referral, have them at least feel comfortable applying fluoride varnish, we're really going to be, our children are going to be much better off health-wise, because as we know, oral health, you're not healthy without good oral health. It's connected to the whole body. So that's pretty much our overall goal.
The interprofessional experience clerkship began 2 months ago at Bellevue Hospital's Department of Pediatric Dentistry. Each session, we have a nurse practitioner student, a medical student, and a dental student, as well as a pediatric dental resident. I hoped that by participating in this kind of experience, it would give nurse practitioner students, as well as dental students and medical students, a chance to get firsthand experience, working with children and just gaining knowledge on oral health and the need to, refer a child at an early age. The program actually exceeded my expectations. Not only did the students have a chance to learn, about oral health in children and actually get to see what cavities look like in kids, but it actually was great to see them working together as a team, which I think is important. I think that, as a pediatric dentist, now that I've worked with some of the nurse practitioner students, I feel like I can, I'd be comfortable reaching out to them, if I had any questions, regarding any medical issues they might have or anything, interdisciplinary that might be needed.
For me, my greatest joy, I've been here 26 years, my greatest joy is the interprofessional collaboration. I've done the nutrition, I'm doing nursing. That's what makes me tick. When I first trained, it was just like, okay, you're only looking at teeth, Jill, And this is so much more exciting because my whole career has completely exploded. I have so many opportunities now. It's just not the dentistry. So for me, I'm thrilled with this collaboration. I'd love to have more.